We had one new case of COVID-19 in hotel quarantine overnight. A member of a aircraft flight crew was picked up via our testing regime, so he's safely in hotel quarantine. Our expectation is the numbers of cases in hotel quarantine will grow because people, in particular returning from Europe, are showing, or Europe is showing more positive signs of growth in, or showing more signs of growth in positive cases. So we're expecting to see more cases in hotel quarantine, which of course is why we have the hotel quarantine system. They're having a massive outbreak in parts of Europe now, so that it's obviously, when Australians return from there, that's causing some risk to Western Australia and Australia more generally. So that shows the value of our hotel quarantine system. Secondly, in terms of doses, we expect to hit 83% first dose over 12 today and 70% double dose over 12 today. So that's very, very strong growth in numbers, and that is continuing. Our forward booking schedule, particularly in the lead up to the dates for the mandates kicking in, is very strong. So lots of people are booking for the end of November to get their vaccination. So that's very strong, and that's a very good sign that shows growth in vaccines and shows the value of our mandating parts of the workforce. Then on to what we're talking about here today. Firstly, we're at the Ellenbrook Clinic. This is a new clinic opening today to provide vaccinations to people in this corridor. It's one of the clinics we've got in shopping centres around the state, and this one is expected to vaccinate around 500 people per day. So this new clinic will cater for the people of Ellenbrook, fully staffed, properly staffed with nurses and the like. So a great initiative here for this area. We have a whole range of these clinics in areas all over Perth and all over regional WA. I won't list them off to you, but there are dozens of them, in fact hundreds of them, around the state. So there's huge opportunities to get vaccinated all over both metro and regional WA right now, including at this new clinic here in Ellenbrook. And so the opportunities are there. I just urge people to go and take advantage of it. It's very easy to do, very quick, very efficient. I went to the Bunbury clinic on Saturday morning. They're doing around 600 vaccinations per day. It was a very busy clinic, actually, so people were lining up to get vaccinated. It was a very good sign. And secondly, we've got Hayden here, Hayden Glass from Red Frogs. So Red Frogs is running part of the Leavers event this year down in Dunsborough. And as we know, Year 12 is about to finish. Around 9,000 to 10,000 leavers are expected to go to Dunsborough. Western Australia was one of the only places in Australia last year to hold a leavers event, and we're having leavers again this year. We expect it will be very popular, as I said, 9,000 to 10,000 leavers going. But one of the conditions is you have to be at least first dose vaccinated. So would encourage all those students who want to go to leavers, get your vaccine, make sure that you register beforehand, and you'll be able to attend all the leavers events down in Dunsborough. If you're not vaccinated, you're not able to attend. So it's an important measure to keep everyone safe and get people vaccinated going to leavers. Red Frogs will run some of the events. If you're not vaccinated, you can actually get vaccinated there. So there is the opportunity to get vaccinated on site. But I just encourage all those students to get off to leavers this year, and I have a son who's one of them, to make sure they're vaccinated before they go with at least their first dose. And that's an important measure to keep everyone safe. I'll hand over now, I think, to the Commissioner to say a few words.
Thanks, Premier. Over 6 weeks ago, we announced that for school leavers this year down at Dunsborough, people would have to be eligible to attend only if they were receiving at least one vaccine. Look, pleasingly, about 2,500 have already done that and registered, but as the Premier just said, we expect some 10,000 will be able to enjoy the festivities in the southwest. Look, I'd like to thank Red Frogs. We've got Hayden here next to me. They successfully managed this event, the only one in Australia last year for leavers, and again we expect this to be a really well-attended, well-run, well-managed and safe event. It'll be safe if all the attendees are vaccinated. So look, there's plenty of time, has been for the last 6 weeks, well known that you have to be vaccinated. Don't leave it to the last minute. I'd like to thank those people that are already vaccinated, but we have clinics available down there but don't stand in the queue. You want to go and enjoy yourselves, get vaccinated now, and make sure that you upload it on the app. For those, there's quite a comprehensive app which provides all of the activities, all of the transport arrangements, where you need to be, whether it's at the meet-up beach day, all those wonderful activities that are down there. But just get vaccinated now and you won't have the hassle of queuing up. Look, in thanking police, health, City of Busselton, the other providers, whether they be from St John's, a lot of the not-for-profits, local government, there's tremendous amount of goodwill here. There's volunteers from the Baptist churches and a whole bunch of people who are actually taking out their own time. They're taking private holidays and they're giving back to the community. I think we as a community should thank them for that. They're not getting paid for it. They want to make sure that our kids are safe and they're doing it in a safe environment. It'll be much safer, of course, if we're all vaccinated. So with that, in closing, I'd like to thank Hayden Glass and his team. They run a very professional, well-managed operation here. We're working very closely with them. We expect it once again to be a very safe event. Thank you very much.
Good morning, everyone. Good morning, Premier, Mr Cook, Mr Papalier and Mr Dawson. Distinguished guests, thank you for having us. It's a privilege to represent the Leavers WA strategy on behalf of all of our stakeholders. Well, it is just a few days until Year 12s descend upon the southwest, and students, along with their parents, are preparing for the week-long celebrations. Red Frogs, along with lots of other support services, have been looking after students at Leavers Week for the past 21 years, providing support in their accommodation and, more recently, the Leavers Zone. Red Frogs provide visitation to Leavers, which sometimes includes a pancake cook-up, referral to other support services, and support in what can often be an emotionally challenging week. So, with these years of experience in mind, we wanted to provide some of our top tips for Leavers Week. Royal Lifesaving want you to stay safe, stay together and know your limits, especially when partying and having fun in the sun and around water. Remember to always wear your Leavers wristband and carry your photo ID, only bring essentials and leave your valuables at home. The WAC crew say that consent is always mutual. Your decision and theirs should always be respected. Research your accommodation, make sure you know their rules. Research the transport options via leaverswa.com.au, and while you're doing your research, make sure you know the law too. Our friends at the City of Busselton ask that you're respectful to everyone and enjoy the community that you're visiting. Enjoying Leavers also means knowing where to go for help. In an emergency, call 000. For everything else, there's a Red Frog hotline, 1300 557 123, who can connect you with the army of volunteers from all the support services that are serving at Leavers and are there to help. From Leavers WA, we want you to have fun at Leavers 2021. Some parents also feel quite nervous about their son or daughter being away for such an extended period. Premier? So Red Frogs have some top tips for parents about how to prepare for your leaver and their celebrations. Talk to your teen about Leavers Week and how they plan to celebrate. Stock your leaver with heaps of pre-made ready meals for the week and some water too. Agree on check-in times and stay in touch during the week to ensure that they are okay. Make sure your teen has a Red Frog hotline number saved in their phone, 1300 557 123. Encourage them to call 000 in emergency. The official services are always there to help. Support services and local government responses are in place to keep Leavers safe over the next few weeks, and more information can be found via the Leavers WA app or leaverswa.com.au. For young people planning to head to Leavers, the Red Frog crew can be contacted through their 24/7 hotline, 1300 557 123. Thank you.
Any questions for Hayden?
Yeah, well, and maybe with the Commissioner with you. So what's the process in terms of enforcing the one jab? How will that work? Is it up to the police to check them going in? How is it going to work?
So what Leavers can do, they can register on the app, upload. When they do their upload on the registration, there's capacity there to upload your certificate of vaccination. That's what's required. You won't be eligible, you won't get your wristband unless you've uploaded your vaccination certificate. Quite easy to do. So I've uploaded my certificate, but I'm not going to Leavers. So it's quite easy to do. If I can do it, they can do it, I'm sure.
Are there like penalties or anything like that for accommodation providers to house Leavers who are not vaccinated or anything?
No. So the registration is for eligibility to get into the Leavers zones. So the accommodation is a private arrangement between people renting.
Do you know how many out of the 9,000 to 10,000 leavers expected to attend have actually done that registration?
About 2,500 at the moment.
So it's still a fair way to go for them to...
Yeah, and that's why my message is don't leave it to the queue on the day when you arrive. There's plenty of opportunity now, one, to get vaccinated if you haven't done that, two, upload it when you register.
Do Red Frog staff and other staff at the event, do they have to be vaccinated as well?
Yes, they do. So, but Hayden, you can perhaps update on that.
Yep. Yeah, all volunteers and staff that are involved in the Leavers strategy are also required to upload their vaccine status to prove that they also have the first jab of the COVID-19 vaccination to keep not only them safe, but the other Leavers safe as well.
Have you had any volunteers who previously have been involved in Leavers that have chosen not to participate this year?
Yeah, we've encouraged all of our volunteers to make informed medical decisions about their vaccine and the status that they hold, and that has meant that some volunteers are no longer serving, not just with Red Frogs, but with other support services as well.
And apart from the vaccine certificate, are there any other measures put in place that kids might notice as different this year about it?
As has been for a number of years with the Leavers WA strategy, it is the safest place to party at Leavers, and so with COVID-19 and the pandemic, there's extra sanitisation stations at the Leavers zone. There's also increased cleaning regimes across the contractors at both the zone and all the other Leavers events as well. And I know that all the other support services are putting in place measures to ensure that it continues to be the safest place for young people to celebrate and party at Leavers.
And Commissioner, I'm assuming there are penalties. The same penalties would apply to anyone trying to beat the system at Leavers as would just apply across the general community?
Yeah, look, I'd caution anyone that is contemplating to try and game the system. Gaming is probably a light touch description. It's actually a criminal offence. If you want to attempt to enter by way of fraud or forgery, you're liable to... And look, why would you waste all of your education up to year 12, you want to go to university or get a job, and run the risk of actually getting a criminal conviction? Because you forget about travelling to a lot of countries around the world with a criminal conviction. A lot of young people I've dealt with over many years, when I've charged them and said, do you realise that if you want to travel to certain places, where do you want to go? You got a criminal conviction? Forget it, because they won't let you in. And a lot of young people actually don't even think about that. So, look, I'd very strongly caution anyone that thinks that they can actually get in with a fraudulent certificate or registration, you run the risk of a criminal penalty. I don't want to talk negative, but that's the reality.
Can I ask the Premier how he feels about that? Oh, anything else? No?
Okay. Thanks, Hayden.
Premier, how do you feel about your son's first time at Leavers?
Well, he's a very responsible lad. I'm sure he'll be doing the right thing. I mean, like most parents, it's kind of sad, you know, as your children get older. That's the main emotion I feel. But can I thank Red Frogs that have done doing this, and they're a wonderful organisation, and I'd like to thank them for all of their work to keep our Leavers safe. In past years, as you'll know, some Leavers events were in Bali. This year they're all basically in Dunsborough, which I think makes a lot of parents very happy.
70% Queensland did that today, I think, as well. So we've got that in common with them, but we don't share their move. They're going to allow people in as long as they 14-day quarantine. We're not going to do that.
Except that ours is over 12, so theirs is over 16. So our rate is climbing every day very significantly, which is great news. So we'll get to very high levels of vaccination. We think 90% late January, early February. We think we'll hit 80% double dose first half of December, hopefully early December, and we can set the actual exact day that the borders will open on that occasion. So, look, you know, other states are doing different things to Western Australia. We're far more cautious and far safer than other states. It's put us in good stead over the course of the last 2 years. As I said the other day, acquired cases in Western Australia, that is, acquired cases of COVID in Western Australia, one person has lost their life. One. And other countries have had hundreds of thousands, if not millions. We've had one person pass away who acquired the virus in WA, which is an extraordinary record. We want to keep our very safe approach intact.
What do you say to the speculation that the Ashes are going
Who's saying that?
Greg Hunt.
Greg Hunt.
Okay, I've never met Greg Hunt. I've never spoken to Greg Hunt. I wouldn't know him if I met him. He's got a very vivid imagination. He hasn't spoken to the Health Minister. I just urge the Commonwealth Government to stop making things up.
And yet he said that they had a good understanding that that's indeed what you're going to do.
Well, I don't know why he would think that. He has no basis to say that. The Commonwealth has been difficult the whole way along, the last 2 years, always trying to be very adventurous and unsafe, whereas we have been very cautious and very safe. The adventurous and unsafe approach was New South Wales, and what you saw there was hundreds and hundreds of people lose their lives, mass economic dislocation, hundreds of thousands of people lose their jobs. Whereas in Western Australia, we've been safe and cautious, and we've had the opposite outcome. So, look, you know, I don't want to undermine all of our good efforts and all of our work over the course of the last 2 years at the last minute, and therefore have to put in place all sorts of restrictions, lockdowns, have people get sick and die. It's not long to go till we get to the 90%. Let's just hold the course.
How do you justify relaxation of quarantine for cricketers?
Look, these are decisions, or no decision's been made. No decision's been made. So there's conversation between police and health with Cricket Australia, and cricket would have to abide by the health requirements put in place. So we've put in place very strong measures over the course of the last 2 years for sporting teams, and cricket needs to abide by it.
There's a lot of talk about cruise ships coming back to Australia. How would we deal with that if they were allowed into the East Coast, etc.?
Well, we'd only allow them in after we open up to the east and internationally. So that would be late January, early February next year. You know, cruise ships are obviously a worry, but eventually they'll come back. That'll be sometime next year.
They are apparently, though, lifting that prohibition on them is actively being considered by the federal government.
Yeah.
I mean, duty free came back yesterday, so they've listed the ban on that, and now cruise ships. Can you keep them out if they let them?
Oh, we can from our ports, yes. So we own the ports. So I mean, the Commonwealth understands this. We wouldn't have cruise ships before, you know, late January, early February next year. It'd probably be some time after that because they have to schedule their, you know, their routes and where they dock and the like. But that's fine. Once we get to that high level of vaccination, that will be permitted, but not before.
The Chief Scientist made a pitch for WA unis to combine and, I guess, become a super uni instead of having the individual unis. What's your take on that?
Well, if the unis want to come forward with a proposition, we'd welcome that. So if the universities want to join up, amalgamate, whatever it might be, to create stronger institutions that can promote themselves nationally and internationally more forcefully, we'd welcome that. But it's up to them. They need to come forward with proposals, and then the state government would look upon them very kindly. But it's up to them really to do that. What I will say though is we will have international students back next year because universities don't start till late February, so we'll have international students back next year. We'll work with the unis to put in place attraction initiatives and promotion for Western Australia, and obviously our financial management means we have greater capacity to do that than other states. The only state in surplus, we have the lowest unemployment rate in the nation, we have the strongest economy, the strongest set of finances, so we'll work with the unis to make sure that that happens.
It'd be like trying to amalgamate local government. I mean, they all want to protect their little fiefdoms. I mean, they're all on a pretty good wicket. Why would you share it?
Well, the thing about them is it's up to them. You know.
No, would you expect though that they? I mean, would they? Oh, what a great idea! Let's do this.
Well, it's been talked about over the years. It hasn't actually come to fruition, but it has been talked about over the years. It's up to them if they want to achieve it. If they wanted to do it, we'd welcome it and we'd make it happen.
Have I got this right, that over the weekend there was a new directive for fire and emergency service volunteers to be included in the vaccine mandates?
I'll let Roger comment at the end.
Just in relation to situation off Laurel Shoals at the moment, the reef, we've seen images of dozens of Indonesian fishing boats and fishermen walking the reefs, collecting sea cucumber. there doesn't seem to be any policing of it. What would be your message to the federal government on that?
Oh, well, I've been to Rolly Shoals. I've been to Rolly Shoals on a patrol boat. It's absolutely stunning and beautiful out there, and it's got to remain that way. So I'd urge the Commonwealth to make sure they protect our interests and our environment. That's what Border Force and the Navy is for. I'd urge them to take action.
I mean, just on lockdowns, how do you justify then once WA reaches 80% double dose, and how many cases would how many cases in the community would trigger a lockdown?
Well, it depends on circumstances. So lockdowns is obviously increasingly a last resort. As we get our vaccination rate up, it's increasingly a last resort. So, you know, the key to avoiding lockdowns is high levels of vaccination, and we're tracking very strongly towards getting to our 90% target in January, early February. So that's a good sign. Look, you know, we've had 12 days of lockdown since last April, 12 days. One of the lowest rates of lockdown of anywhere in the world, and that's led to outstanding health and economic outcomes here. But it's a measure that would be a last resort, but you keep it up your sleeve as we track to those very high levels of vaccination so we don't have a mass outbreak and what's occurring now in Europe. But I'm very, very hopeful and very confident that we won't need to do it.
So how many cases like
It depends on circumstances.
It's not new that you face pressure about opening up from other states, organisations and companies. Obviously Queensland opens up in COVID-19 and other states are following soon, probably before the end of the year. Flight Centre have said if you don't open up for 80%, they might sue. What do you say to that? And is there any circumstance where you consider opening up before the 90% target's reached?
Well, we have a very open society and very open economy now, and I think there's a lot of misunderstanding by commentators in the East and the Commonwealth Government and the like. They keep saying, oh, Western Australia needs to open up. We are open. All of our shops, all of our businesses, everything is open. The only thing that people can't do is go to New South Wales, Victoria, the ACT or fly overseas. That's the current rule, and that will stay until we get high levels of vaccination in late January, early February. In terms of people threatening to sue us, we've been through this before. We had Clive Palmer, we had the Liberal Party and the National Party. We had all those people. We defeated those cases. I expect we'd defeat them again.
Last week you announced that you'll double the international arrival cap. Don't you think it's a little bit, I guess, weird, for lack of a better term, that someone from Victoria could fly overseas and have a better chance of getting into WA and doing 2 weeks worth of quarantine than just coming from Victoria and doing 2 weeks worth of quarantine?
No. The overseas arrival cap has been in place now since March of last year, and we reduced it very, very significantly. But returning Australians has always been something that every state of Australia has assisted to occur. Obviously, we are increasing our cap because our vaccination rate is increasing. That was a change we agreed to. I think it's a sensible measure.
Is that, I'm sorry,
November 22, I think, from memory.
and that's doubling,
Yeah, it goes to 530, 560, around that. 560, I think it is, as of something like that, as of November 22. So that means we'll have more people in our hotels. It obviously puts pressure on our hotel quarantine. It means we have to be doubly cautious in managing the hotels because obviously, as they have been over the course of the last 2 years, they're a risk.
Ashwaria's parents obviously suggesting that an ex gratia payment of around $5 million is required from the government. How do you feel about that, and how will you approach it? Will you wait until the corona inquiry?
Look, I understand that they're a family that is going through much pain and much suffering, and it'll be a very difficult period for them, and will be, I expect, for the rest of their lives. So I understand that they're in a lot of pain. In terms of anything we do in that regard, I think you've got to wait till the coronial inquiry is held. Obviously, that will determine many things.
But you obviously, as Premier, you would talk about that at Cabinet rather than have to go through some protracted legal dispute with them?
Look, we'll await the coronial inquiry.
Premier, why can't your minister give evidence about the dismissal of one of his staff from his elected office?
What are you referring to?
Well, John Quigley's intervened to prevent, I understand, the minister from being called to what is effectively just an unfair dismissal case.
I'm sorry, I don't know anything about that.
So you don't know that that's what John Quigley did?
No, I don't know. I don't know what you're referring to. All right.
So just in relation to that particular question, the volunteers will be captured under that Group 2, which means they need to be vaccinated first dose by 31 December, second dose by 31 January. Obviously, volunteers interact with professional firefighters and rescue workers, so it's important that they too are covered under these arrangements.
So they had been excluded originally. What was the change of heart there in that?
Well, there's obviously challenges in relation to volunteers. They have a different relationship to the workplace, for want of a better description, than professional firefighters. But obviously, we understand that they too will be called into a situation where they can't guarantee the safety from a public health perspective because it'll be under emergency circumstances, and so we thought it was best that they be captured.
So we're hearing from the bushfire volunteers who have real concerns that they might be turning away unvaccinated volunteers over the summer season. Do you have those same concerns, that they're pretty genuine and worried?
Well, there's always concerns in relation to the mandatory vaccination policy, but it is there for a reason, and that is we want to keep those people safe. We want to keep the people that they interact with safe. This is no different from discussions around things such as seatbelts. We understand they're an inconvenience. We understand that some people are against it, but there are strong public health reasons for taking these measures. And from that perspective, we need everyone to cooperate. Obviously, we want to work with people. We want to make sure that they take the opportunity to get all the information they need to make an informed choice. But at the end of the day, it's the public health risk and the public health safety that we have to address.
You didn't include them. You didn't include them when you announced that it would be mandatory for career firefighters to get vaccinated. Why didn't you do it?
Oh, in the first instance, we were obviously focused on the career firefighters because they live in close quarters with each other. When they're on shift, they are called out to a much larger number of jobs or call-outs, and in addition to that, when they are called out, it's not into a situation such as a bushfire. It's generally in a much more confined and higher level of interaction. But we understand that there is a good case made out in relation to volunteers as well, and so we're gathering them up in that second group.
So it's not just firefighters, the volunteer firefighters. It's SES as well.
SES,
all
yep.
the volunteers.
That's correct. Yeah.
So you get a crash up near Northam and you don't get the volunteers attending. Is that likelihood?
Well, I don't think it is a likelihood, but it's obviously we need to make sure that as we now step through the second tranche of our mandatory regimes, of our mandatory framework, that we sit down with all the stakeholders and individuals involved to make sure that we can understand their concerns, make sure they can understand what we're trying to achieve. The roundtables that we've been having with industry groups and professional bodies and unions have been outstanding in terms of being able to tease out the issues, making sure that we capture it in a way which protects people in the workplace and the people that they serve or interact with.
Minister, why would you give evidence in the dispute, in the employment dispute involving your former staff?
Well, look, these are matters for the Attorney-General, but essentially the circumstances with regards to an employee in that situation, the employing authority is the Department of Premier and Cabinet, not the individual member.
Yeah, but you were germane to that sacking.
Look, I won't comment on the actual individuals, on the actual circumstances. This is an appeals board. It's a board that's there to hear these sort of issues. It's not a court of law, and I've been advised according to by the Attorney General.
So would that be fair if she was found to have a righteous case and you weren't there to give evidence? Would you accept that?
Look, I don't know the legals in and outs in relation to this. I've accepted advice from the Attorney General.
So it's the Premier's responsibility, is that what it is?
No, this is a function of government, and I'm advised by the Attorney General in relation to these matters.
In terms of Ashwari's parents, should they have to wait for a coronial inquiry? It's pretty obvious that the system failed, and no one's doubted that. Should they have to wait for that to come through?
Look, there are a range of reasons that led, or there are a range of circumstances that led to that little girl's death. It's a tragic and horrible situation. It's one, obviously, which has impacted the parents, it's impacted the teams that were on roster that night, it's impacted everyone at Perth Children's Hospital. There is a framework for hearing these sort of concerns with regards to ex gratia payments. We'll go through these. Ultimately, we'll be provided with advice in relation to these matters. But I'm very happy to meet with the family. I think I'm meeting with them later this week and looking forward to that discussion. I understand, they want to be able to now consider this as an option for them. There are processes which need to be followed before we can actually consider that sort of request, and I think the coronal investigation will be part of that.
Minister, there were 3 heart surgeries cancelled by Fiona Stanley Hospital due to unprecedented ICU demand last week. Can patients feel safe in WA hospitals?
Absolutely. Western Australian hospitals continue to do an outstanding job in very challenging circumstances. We have significant increase in demand on what we would usually be experiencing. That's a feature of this post-COVID period, and all our hospitals are working day and night to make sure that we can deal with that demand. In addition to that, we're also doing a whole range of other work to engage new beds, a significant increase in beds of 270 extra beds, including extra ICU beds. At Fiona Stanley alone, we're increasing the number of ICU beds by 10, and we're in the process of commissioning those beds at the moment. But Western Australia's hospitals, like all states' hospitals throughout this country, are really struggling with very high demand at the moment. What we can do, which other states cannot do, is that we can invest because we've protected the state's finances, and that's why you've seen a significant increase in funding, $1.9 billion increase in the 21-22 budget, and another $400 million increase in investments that the Premier and I announced just the other week. So we're in a position where we can address these high levels of demand. Thanks very much, everyone.
Thank you.